My name is Jeremy Myers. I'm the Fellowship Director of the GURS Verified Fellowship at University of Utah. I'm really proud of the fellowship, and it started about 6 years ago in a co-fellowship between Men's Health and Urology and Reconstructive Urology. About 3 years ago, we transitioned to a fully GURS Fellowship. The strengths of the fellowship are the operative exposure and the academic development that's provided to the fellows during their time at University of Utah. The first thing I wanted to talk about is the clinical experience at University of Utah for fellowship training. University of Utah is geographically isolated by the Rocky Mountains to the east and by California and the Northwest to the west, and it covers a vast geographic area, and there are few, if any, competing large academic medical centers. And for this reason, we take care of a lot of advanced pathology, and we have largely unopposed in development of reconstructive urology programs. And in fact, patients will travel up to 8 hours to get care at University of Utah, if not longer. So this geography has created the necessity of offering the breadth of reconstructive urology to our patients. Because of this breadth, University of Utah is a fantastic place to train as a resident and also as a reconstructive urology fellow. Our fellows get exposure and really become expert in treatments of urethral strictures. And in fact, within the TURNS network, University of Utah competed for the highest volumes of posterior urethroplasties after pelvic fracture urethral injury. In addition, there's many bread and butter urethroplasties, and we average about 80 to 100 urethroplasties per year.
The clinical year has been a very rewarding experience so far. There's so much volume and breadth and depth to the cases that you see here at the University of Utah, and that makes for a very educational experience. It's only 2/3 of the way through the year, and already I feel reasonably comfortable managing anterior and posterior urethral strictures, continent and non-continent urinary diversion, and gender-affirming surgery cases. So it's really been great in that sense.
Another strength of the program is transitional care and neurogenic bladder care. University of Utah is physically attached to the Primary Children's Hospital, which is the only pediatric hospital in the Intermountain West, and there are 5 pediatric urologists within our division, all working very hard. So the volume of patients that need to transition care as they age is really tremendous.
Hi, I'm Ben McCormick. I'm one of the reconstructive urologists out here at the University of Utah. I'm originally from West Virginia, but was fortunate enough to come out here for surgical training and to stay on as faculty, starting my practice within the last year. My practice runs the gamut of reconstructive urology, but I particularly enjoy gender-affirming bottom surgeries. I think the cases are challenging, the patients are wonderful, and I find it really rewarding. I also enjoy robotic reconstruction. I think when practically applied, it has a real place and can benefit patients immensely. Really looking forward to seeing you all around Utah.
As the fellow, I've gotten to take the residents through several portions of complex reconstructive cases, and when I'm on call, I guide them through more straightforward general urology cases, and that's been a very rewarding experience, and they're all very teachable. One of the important clinical responsibilities for the fellow at the University of Utah is to take staff call. I found this to be a very rewarding experience because it's the first time that I've been able to act as an independent staff urologist when looking after patients. And so this has been very rewarding. The residents are the first line of defense when you're on call, and they protect you from all the scut work and the challenges that come up with call when you're a resident. And they're actually quite capable at managing most of the non-operative care for patients without direct supervision. And then when there are operative cases, you get involved as the staff on call. And I found call very rewarding because it's an opportunity to take care of patients from A to Z on your own, but still know that you have the support of the more senior urologists. Everybody is so skilled and so experienced, and at the same time, very humble and down to earth, which really makes it a pleasure to come into the hospital every day and to provide excellent patient care.